the overview of trauma is one that one could give in maybe a few hours or a few days. So what we've got here, okay, is an overview of an overview. We're looking at something from a high level. We're looking at something that while it affects all of us, I'm going to be speaking in terms of principles. I'm going to be speaking in terms of definitions and possible practical applications at the end. But what this is not meant to be is medical advice. So I'm not a specialist in trauma psychology, but I have a lived experience of it. And so part of our research within Momentum is to find the research and then to share that out with the world. So if you are affected in any way by the topics we're talking about, it's really important for you to seek help. If it's really, really acute, then it is more important in times of crisis to go and find some way in which you can find relief from trauma. So I'm going to start by looking at a definition of where we're going. Just bear with me a second as I reset the screen to the beginning. Now this is really important. This actually is the last slide, but it is also the first slide. And I think it's so important because we think of disease as, yeah, it's just me. And that is true. So you might have a broken leg, you might have something that's affected you personally. But trauma is a disease that affects an individual and takes you to a place where you are totally isolated. And part of, again, starting at the end, is that to bring you back to health, we need to come to a point in which it is collective. So, again, here we are. The definition of trauma is that it's an unseen pandemic. It is something that affects, like I say, all of us, and you may not see trauma. So all of us have had trauma in our lives. It could be somebody who's died, it could be a job that you've lost, it could be that you're in the middle of grief, it could be any of a number of things which, if you meet them, or if somebody meets you, they will not be able to see what is the thing that started it all off. What you will see is the effect of trauma. So as a definition, we are looking at this. What is it? It's an event or series of events that affects how we see ourselves and causes us to act in a negative way. So that sort of is ingrained, it's in the back of where we are with this topic. An event that affects the way we see ourselves. And so what happens is that you see yourself in a particular way, you act in a particular way, and it's usually negative. But from the outside, what you might see or what someone else might see is what they might say, oh yeah, that's really bad behavior. So I know friends, I have family who's saying, well, yeah, we know these kids, for example, and all I see is naughty children. But you're not able to see the event that caused the behavior that allows them to see themselves in a way that creates the behavior. So if I move in the right direction, the effects of trauma, the first effect is really important because here we're looking at, I use the word hyper-vigilance, but talking in terms of, if you've ever seen the movie Spider-Man, and you know Spider-Man goes into a building and it's suddenly like bing, 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 bing. He's saying there is danger, there is danger, there is danger. The first thing that trauma does to us all is it puts you into that place where you're hyper vigilant. So there's normally, you walk down the street and a noise might sort of impinge on your consciousness. But a hyper vigilant person is one in which the noise is you're finally attuned to danger, which may or may not in reality exist. The second thing in terms of trauma is that there's a disconnect between what you experience, usually what you see, and your ability to speak about it. And I'll come back to that at a later point in time. We touched a little bit on behavioral problems. So it's naughty children. It's co-workers who seem to be obstructing you at all times. There are people who are saying one thing to your face, and as soon as you turn around, it's like, hold on, this is a different person, because their behavior isn't matching with what they portray. The next thing in terms of trauma, and coming down to long-term effects of trauma, is things like chronic inflammation. Again, we'll come on to that. Lowered immunity, gut issues, and lastly, and perhaps for me the most important piece in all of this, is epigenetic changes. So epigenetics is a branch of science that is now coming to the front in the last 10, 15, probably more, probably 20 years. It comes from the idea that people would say, it's in my genes, it's in my family, my father was like this, my grandfather is like this, therefore I'm going to be like this. Most times people talk about it in terms of weight. My dad, for example, said to me, his dad died at 60 of a heart attack. And his dad's died at 60. So he was fully expecting that when he hit 60, he would no longer be with us. What he didn't realize, and what we didn't realize at the time, is that the environment is changing the expression of your genes. And so what one generation experiences is not necessarily what everybody is experiencing. However, with trauma, we've seen it where the genes that are expressed in kids start to be expressed further down the line. It's the way in which we can understand why is it that somebody who's been abused turns into an abuser. Perhaps more on that later. Let me look with you at this. This is a diagram of your nervous system. This is a diagram of something that is autonomic. This is your autonomic nervous system. This is a healthy thing. So on the left-hand side, you see you're asleep, okay? And it's suddenly you wake up, it's all calm, you start to have your coffee, you open your mail, perhaps you see in your post something that says, Johnson, I'm sorry to have to inform you, sir, but your mortgage payments are behind. And you go, oh, all right. And you start to think on it, you start to ponder, and you start to work out what's going on. You get it to a little bit of stress. And it might be that 2 hours later, I'd get really stressed. I get to a space where I'm panicked over it. And this is the point in where your sympathetic system is in the ascendancy. It's there when your heart rate goes up, your eyes are dilating, everything's shutting down in your periphery. You're not thinking about eating, you're not thinking about replication, you're not thinking of any of these. You just need to sort out this problem. Our bodies are designed to do this because historically we're looking and seeing what you need to do to survive. So your sympathetic system is one in which it gears you up to do something. We talk about it in terms of the fight or flight. So the first thing is your body is saying, I need to do something. How do I get all of the stuff I need, the resources, in order to take action? So the heart rate going up, adrenaline going up, cortisol going up. What it does is it pushes you to the point where you're like a coil spring, you're ready to go. The cortisol is important because it is pushing all of your blood sugar out from your cells into your bloodstream. And that's good on the short term. On the long term, it's going to cause a little more difficulty. But let's just look at that later on. So the sympathetic system is being activated. But you're cool, you had a good sleep, you're fairly relaxed, so you calm down. And then you think about it a little bit and it goes back up. Your stress level goes up. But eventually you calm down. And it's pretty normal. You can sort it out. You're not overwhelmed. You can perform. You can relax at the end of the day. So at the bottom, you see the axis there is time in hours. And that's one example of an event. It's not a traumatic event. It is an event that happens. And again, if you look on the right-hand side, when you start to come down, it's your parasympathetic system. It's the brakes that going, okay, you can calm down. It's where your blood pressure drops, where your pulse rate slows down, where you go, I'm hungry now. Where I wasn't hungry before, but I'm now hungry. So that all the other systems in your body are coming back online. Here's what it looks like with somebody who's traumatized. Let's say you had a massive car crash and maybe you've sustained a lot of injury. And this person would be one in which you'd be thinking, I could never go in a car again. It could be somebody who's sort of like say, is thinking it's all my fault what happened there. How could I be such an awful person? And they start as say, we go back to the beginning, think of themselves in a particular way, and then they act in a particular way. So it might be you become defensive. It might be you become narky with other road drivers, or it might be you get hypersensitive to anybody who comes near your car. So on the diagram you're seeing, on the graph, first thing you'll see is probably not that clear, but that somebody who's traumatized, their triggering is a lot lower. So what would trigger somebody to get them upset who's not had that experience would be that it would have to be maybe not one near miss, maybe not one person who sort of cuts you up in the road and swears that, it might take 5 or 6. But for somebody, the trigger level is lower. And also the reaction is shoop. It's up quick, as opposed to something which is a lot more gradual, as you see on this. The line going up is more gradual. But for somebody who's traumatized, the line going up is much quicker. And they remain in this state of fight or flight or freeze, where they're there for a long time. They're really stressed out. You can see it in the face. You can hear it in the voice, where it might be somebody who's going for a job interview and they say, oh yeah, my throat's really, I can't speak. It's difficult. It's so difficult because I'm in that place. And they may stay in that place for days or for months. And you might drop down, if you see, into a couple of U's, but you're not really fully relaxed. And you go up again very quickly. And what typically tends to happen is that person drops like a stone. When all the adrenaline disappears, you go from to totally exhausted, absolutely exhausted. So that's the nervous system in terms of a traumatized person. In terms of what's going on with the hormones, okay, it becomes really important because so these are acute situations. But then we can go into chronic situations, you know, where it could be something like bullying, it could be something like neglect or domestic violence, where they're in this state for a long period of time. So trauma can be acute, but trauma can also be chronic. It can be complex. So in war situations, in places where, you know, you've got extreme poverty, the political systems at play that are pushing you into this place of a complex trauma situation. The last piece is what people call a vicarious situation. So these people are like doctors, maybe not lawyers, perhaps, health workers, people like the police, people who in the army, who are seeing other people suffering. And the trauma that they're seeing gets on top of them and it starts to wear you down. It starts to say, oh, I'm tired of seeing all of this. I can't cope with all of this. And that's a really important piece that we're not going to touch on today, but just to say that it is there. The other piece I'm mentioning is PTSD, is post-traumatic stress disorder, and post-traumatic strengthening or growth, where some people seem to get hammered really badly, and then there are groups of people who seem to almost thrive on it. Now, we're not going to touch too much on that, except what I will say in that is that people who seem to get stronger after a period of trauma, it tends to be women more than men. They tend to have people who are, in terms of personality traits, have two main traits. So psychology talks about openness to experience and the ability or the preponderance or the way to be is that they're more extroverted. Why this is important is when we come on to talk about how you deal with it or what are the treatments are, is that remember I said to you, trauma pushes you to be isolated. But people who are extroverted naturally tend to gravitate towards groups. They tend to talk about things more. They tend to be more open about saying things. The other piece in terms of the psychology piece is saying, yeah, if you're open to experience, in normal language, you tend to be more curious. People like that tend to go, I wonder why. I wonder what happened. I wonder if I could have done something different. I wonder, and they're more able to play with concepts and by so doing, be able to pull themselves back from being engrossed right in it. So these sort of traits, which are learnable, by the way, so you're not necessarily all curious to a huge degree, but I'm convinced you can learn these things as skills. These things allow us or allow people to move from post-traumatic stress disorder to post-traumatic strength and growth. It is all possible. If you look at trauma and brain development, so forget the bottom half of the diagram for the moment. All our brains develop from the brown bit, which is your reptilian brain, up to your limbic system, and then moves up to your neocortex, which is the new part. So the reptilian brain is the bit of your brain that is in charge of the fact that you breathe, and you don't have to think about it. It's in charge of the bits that your heart rate, and you don't think about, I need to pump blood wrong, so I need to make sure my heart's beating. These things are happening automatic. And that's the bit that starts off the earliest. That's the bit that, if you look downwards, is it, in terms of development, is what it's about survival. It's about keeping you alive. The next piece here are combined. The green bit of the brain is the limbic system. This is the bit of the brain where things like emotions are found. This part of your brain looks at arousal, it looks at fear, it looks at love. All of these positive or negative emotions are found here. The last piece of the brain that develops is the cognitive part. It's your cortex. It's actually your prefrontal cortex. And that's the bit that has to do with language. It has to do with time. And this, talk about it again. Time is really important. So if we talk about it in terms of developmental trauma now, and I just switch on to children, it is key to realize that the younger you are when you have big traumas, the more we are affected in adulthood. But the harder it is to spot what was the initial cause. So let me give you an example. There's a boy who's been he's an 8-year-old boy. He's been in and out of foster care. He's been taken away from his birth parents for a long time. After 2 or 3 years, he's in school and he's learning and he's developing and everything seems to be going well. And suddenly, this child starts with a lot of bad behavior. He looks at his male teacher and he says, "This man hates my guts. This man is absolutely awful. I don't know why he hates my guts, but he hates my guts. He treats me like all the things that you don't want to be treated like." And this is this is what the child's coming out with. So someone sent a psychologist in, an educational psychologist, who sat in the room with them. And he sat with them and he looked, and he couldn't see anything wrong with his teacher. This guy was a fairly ordinary guy. He seemed to treat this boy the same as he treated anybody else. But yet this behavior was coming out. So what happened next was that the psychologist happened to notice that the boy's father was coming to visit him. The boy's father doesn't live with him. And he was sitting in a room watching what was going on, the interaction between the two. And he started to see the behavior that the boy had with the teacher, with the same as with the father. And the father was showing that he was actually drunk at the time. And you think, yeah. So is it that a drunk father is now being translated into the teacher? Possibly. And he sat there, and as he sat, he said to the boy's father, "Have you got cologne on?" And his father said, "Well, yeah, I've got my favorite cologne. It's Old Spice." Because what that man did was he used the Old Spice, the cologne, to try and mask the fact of the smell of the alcohol. So they went back into the classroom, and the psychologist said to the teacher, "Do you by any chance use Old Spice?" And he said, "Yeah, that's my favorite cologne." So what was happening was that this child was being triggered by a smell, by a sense that was external, and it was triggering emotions of fear, of being afraid, of looking out for being hit again, for being abandoned, And just remember, as I said, if you look on the diagram, the reptilian brain is the one that develops first. So the neocortex is offline. It's not connected. It's not developed yet. And what's happening is that the reptilian brain is the one that's forming the memories. So memories are important in trauma. The memories that a reptilian brain forms are not the same as one in which an adult would form, where you've got a neocortex that's fully functional. The reptilian brain forms memories, and especially with traumatic memories. They're isolated. There's a memory here, there's a memory there. But remember, language is in the neocortex. So the child who's experienced a form of trauma is not able to say what they're feeling. They feel something, but they can't express it. And it's like, and we've seen this time and time again with adults who have experienced trauma in things like earthquakes, in terms like 9/11, in terms of any major thing where they've got to the point where the neocortex is switched off. So it's vitally important to realize that you have a brain that works on different levels. The reptilian brain, then your limbic system, which is where you're processing all the emotions that are coming in. And then your cortex is trying to make sense of it. It's trying to say, oh yeah, okay, this is the story. The cortex is where you have a story that's linear. It goes, once upon a time, this happened at the beginning, then in the middle of the story, and then the end of the story. When you have trauma, you don't get that straight line. You get emotions without any sort of connections. So you get flashbacks. You get something like, suddenly I'm in this dark room and this person hovering over me with a knife. Or I'm walking down the street and somebody grabs me by the throat. These sort of memories or these flashbacks there, but they're not connected. So that it's very, very difficult to do anything with it. And people get trapped in this. Like say, we get trapped in this. The second reason we get trapped in this is that time, or your ability to work with time, is dependent on your cortex being online. So for somebody who's been traumatized, they can't tell time. And I don't mean by looking at your watch and saying, what time is it? I'm saying by being in a place. And so you're living in 1975, but it's actually 2022. And you can't tell the difference. You're living the past as if it's the present. So you're living a past, you're living in a space where you can't get a linear sense of where we are. And in terms of children, okay, you come back to children. This is why, if you look on the right-hand side of developmental trauma, be it abuse, be it neglect, be it whatever it is that's there, the first thing is thinking about survival. Then cognition is very difficult. There's one saying that goes, a safe child is a learning child. But if a child who doesn't feel safe is not able to learn, they're distracted, they're distracting others, their behavior is one in which they just don't feel safe. So in terms of children and learning, this is important. In terms of adults, this doesn't come out as learning, but it comes out in different ways. But it's still cognition that's the problem. So I'm left here and I'm thinking, you might be thinking, oh, that's pretty awful, Johnson. What do we do with all of this? Is it possible to do anything? And the answer is yes. The answer lies in not one way of dealing with it, but several different ways. So just to say, um, there, there are a few ways of dealing. The first one people talk about is talking therapies. Talking therapies, psychotherapy, counseling, CBT, all of these things have their place. But it's based on the relationship. Any talking therapy is based on how I get on with you. If I don't get on with you, if I don't trust you, it's not going to work. So from a counseling perspective, there's so many different ways of approaching it, but every single one is based on trust. It is based on security. It is based on relationship. And any single way of treating trauma, the goal of all trauma treatment is that you will be able to see and experience something and face it and deal with it. So it's important to say, yeah, you're building relationship, you're talking about it. The difficulty is sometimes people who go to psychotherapy or go to counseling come out worse than they went into because you expose trauma but not being able to move past it. One of the things that you could do as well is moving therapies. So things like yoga, things like Tai Chi, things like dance. There's someone that I follow his work quite closely, James S. Gordon, which I reference at the end. James Gordon talks about when he goes into places like Gaza, or he goes into earthquake, or he goes into Haiti, and he goes in there and he looks and sees what is the trauma and how he can deal with it in a group setting. And that's one of the important pieces. It's in a communal setting that he deals with trauma. He goes in there and he basically does dance. So he gets this group of people in together and they start to, all this sort of thing. And you're going, wow, okay, that's good. What's that got to do with trauma? Because most of the times, the trauma that we have is trapped somewhere in your body. The trauma that you have is in there, but you're not aware of it. So our senses, you have 5 senses. You can see, you can hear, you can touch, you can smell. It's all coming from the outside. But there's also what's called interoception, where you're getting a sense of what is your body feeling. So if anybody does any work with people in terms of weight loss, for example, they say, well, just stop for a minute. Is your body telling you you're hungry, or is your body telling you you're full? And for a lot of people, they've never heard that before. What do you mean your body is telling me I'm full? Are you feeling full? Well, by the time I know, for at least for me, sometimes you think you're full, but it's an hour later before your body starts to tell you. But your body's been telling you all this time, but you've never actually been aware of it. And so it's the same with things that are traumatic. When your body is tense and you think, okay, so here you are, you're in that place where this man's beating you up again, and you're there, and you say, okay, so where are you tense in your body? Oh, it's here, isn't it? Okay. And what's your heart rate like? Oh, it's really fast. And so you're connecting with what your body is saying and what the emotion is. And once you start to make those connections, you start to think, okay, well, yeah, actually I'm feeling this, but actually it's now 2022. It's not 1970 something or 1980 something. So it starts to draw you back into the present. Being aware of where your body is in it allows you to draw yourself back into the present. So James Gordon does this thing where he does dance, and he do maybe 5 minutes of a dance song, and he does exactly that. He says, stop. Just listen to your body. What is it telling you? What are you feeling? What are you hearing? What are you saying about yourself? And you just hold all those things, and then he'd restart a dance routine in a different rhythm, a different beat, a different song. And excuse me. It allows it allows people to move on from that place of where they've been to a new place. He uses that to help people in terms of mass traumas. The other modality we have is with drugs. So that when you're in the acute phase of something, when somebody is in a dangerous place, they might give you a sedative, they might give you a sleeping tablet, they might give you an antipsychotic, something along those lines to calm you down. Those really work, they're really important, but they're acute phase. So I'm not anti-drug use, but where we're in a place now where the world is thinking, here we've got limited resources, we've got limited time. If you go to see a doctor or a psychiatrist or a counselor, you might get 7 minutes with a doctor, you might get an hour with a counselor or a psychotherapist, or a psychiatrist would give you a limited number of time. And then they resort to medication. Medication is great, but I call it a chemical kosh. In this case, you don't know what a kosh is. It's that thing they hit you over the head with. You see it in all these old police films. It calms you down, and you go, it's good. But as it calms you down, it calms everything down. It sedates you. It's like the anesthetic. So when I used to do anesthetics many years ago, it's like you go in for your operation, somebody gives you an anesthetic, then you wake up and realize, hold on, they haven't done the operation. That's what a chemical kosh could be like. So it has to be used, in my opinion, with something else. You can't just use medication on its own. The really important piece, again, for adults or for kids is creativity. Creativity comes in many forms. It could be drawing, it could be storytelling, it could be improvisation, it could be drama. All of these things allow someone to feel safe, to back off from a trauma, and then get back into it knowing that they are safe, knowing that you can face these things again. There's lots of work, for instance, around hip hop in inner cities where people are doing exactly that. They're not dealing directly with a trauma, but they're allowing kids to get to that place where they can see it, they can not be stressed to it, and then be able to deal with it. So a lot of the trauma work, like say, is feeling safe and making the right decisions. So it is that sort of thing that creativity allows you. Journaling is another big piece to that. And at the end of the day, what I've said to you is that community is important, because any form of trauma, any anxiety, any depression pulls you to that place of isolation. And where we've been in the last couple of years is isolation. And isolation just locks you in prison and throws away the keys. For most of the work around trauma, we need to get to a point of trust. We need to get to a point of the ability to speak to someone, to do things in a way that disconnects you from a bad memory. The last piece in it, which is really, really hot off the press in the last 5 years, is experimental treatments looking at psychedelics. So in the past, people have backed off psychedelics and treatment with for all the right reasons, because it's been used in a place where people have died, people have gone on trips, and they've not come back. But now we're starting to look at it in a way that's more controlled. And the early results seem to be that it allows people to see and connect with memories. And remember, like say, a lot of the issues we have is in and around memories, where memories are isolated and they're terrifying, and I can't get past it. So sometimes psychedelics allows people to see memories and to go be a little curious. Isn't that interesting? So this thing happened to me as a child. Isn't that interesting? And when you get to that sort of observer perspective, then you don't have the immediate shooting up the fight or flight response curve to a more considered approach. Maybe I didn't need to shout. Maybe I don't need to be as nasty as I am with my colleagues, because they're not out to get me. And in so doing, like say, we can disconnect a distant memory and put it into a timeline that we can deal with. So at the end of the day, like say, we're talking about trauma, and like say, this is not medical advice. These are some of the principles. These are some of the ways in which it can be dealt with. The more complex the trauma, the longer it will take to unravel.